Felician Nursing Informatics students, I'd like to introduce Dr. Autum Shingler-Nace, who is the VP of Operations for Jefferson's Washington Township Hospital in New Jersey. Her roles prior to this include Assistant Vice President of Clinical Operations at Jefferson Health, Clinical Director of the Children's Regional Hospital at Cooper University Health System, and Director of the Surgery Center at Heritage Valley Health System in Pennsylvania. She also held several leadership positions at the University of Pittsburgh Medical Center, where she was honored with a Quality Fellow Award in 2014. Dr. Shingler-Nace received her doctorate in nursing practice degree from the University of Pittsburgh in Health Systems Executive Leadership and holds a master's in nursing administration from Waynesburg University in Pennsylvania. She is a board certified by the American Nurses Credentialing Center, a member of the Sigma Theta Tau International Honor Society of Nursing, American Organization of Nurse Executives, and American College of Healthcare Executives. Thank you so much for joining me today, Dr. Shingler-Nace.
Oh, you are very welcome. I'm happy to be here with you today.
So I understand Jefferson's Washington Township Hospital, a 230-bed acute care hospital, is undergoing a $222 million transformation, including the opening of the Silvestri Tower. Can you tell me a little bit about what this project entails regarding innovation and technology?
Yeah, sure. So we actually moved into the tower in July. So it's been a couple months that we've been into it, and it was a large expansion. Jefferson, Washington Township is a part of the Jefferson enterprise, which is now 18 hospitals. So we're a large integrated health system. And so one of the goals of this expansion was really to allow patients to stay in New Jersey and not have to travel into the city for acute care needs. And so there was a lot of thought put into this process from a technology standpoint and how we can better serve the community, because we know that patients want to stay close to home if they can. So in our new tower, we have a lot of what we call smart rooms. And in those smart rooms, we have a lot of patient-controlled applications. So our patients are able to manage the temperature in the room. They're able to manage the lights, the blinds, the shades. The call bell system is integrated with the nurses' phones so that they are able to contact their nurse directly. And there's also alerts for what the patient needs. So we have, just like many institutes, a no-pass zone, but the patient is able to alert what they need. So if they just need water, or they need a medication, or they need something else from their nurse. So it empowers other staff to go in essentially and help our patients too. If they know that someone needs water, really anyone can go in and do that for them. So it's not as intimidating for the no-pass zone as we know for some people to go into a room and not know what a patient needs. So that's one of the things that we had highly focused on. The other thing is we actually have electronic whiteboards in all of our rooms. And with the electronic whiteboard, we really have the ability for the patient and the family member to integrate with the patient's care. So the care team is on that whiteboard. It all integrates with Epic, which is the electronic health record that we use here at Jefferson. And so the care team is on that board. They can actually see pictures. So how many times do we go in and see our patients, and you say, "Hey mom, who did you see today?" And they say, I don't know, some doctor was in here, or there was somebody in here, but I don't know who. Now you can actually see the pictures and say, "Oh yes, that person was here, this person was here." They can pull up all of their medical information on those whiteboards with a swipe of a badge, so we can show MRI testing or any lab testing, any results, any scans for that. We also have the ability to do a lot of the wayfinding and kind of information for guests and visitors. So what time is the cafeteria open? Where's the gift shop? Where's the maps? Really kind of an all access point for visitors as well. Our patients also all get iPads. So they have ability to use the iPad, go into My Chart at any time and see their information at the touch of their fingertips, essentially. So we have that as well. We also have boards, electronic boards outside of all the patient rooms, and all of our patient rooms are private. So that's really helpful, but there's boards outside of the patient rooms also, which allow us to integrate with Epic so that before you go in the patient's room, if the patient is NPO, if the patient's on isolation, there's a lot of different things on that board to alert you of what you're walking into before you even go in. So that helps with our food and nutrition staff, any of our support services, to better enhance the communication. All of our nurses have iPhones, so most of our integration is all through iPhones. We have direct messaging through Epic, so that has really been helpful, as well as really leveraging Epic to help us with all of the technology that's been implemented in all of our patient rooms. And so we've really focused a lot on Epic optimization, because that is something that we are able to do with the large, vast hospitals that we have really in our health system. We've really been able to leverage Epic to do exactly what it is that we need it to do to assist us with our patient care and the patient experience. So lots of thought, lots of process into that. And that's really just in the inpatient areas. We also expanded some of our procedural areas too. And there's a lot of different technology similar to the inpatient side on the procedural side as well. So lots of thought went into the technology piece of this.
That's totally amazing. It sounds so integrated and streamlined, just amazing. As a nurse executive at the VP level, how do you get involved with these kinds of decisions with regard to technology and these investments? What's the biggest challenge for you to that end as well?
So I think, you got to get yourself involved. So that's one of the things, you got to be at the table when the decisions are being made and make sure that you're really advocating not only for, what the patient needs, but also what the employees, frontline staff really need, and really trying to understand that. As a nurse, being an operational role, it's helpful to me because I understand what it's like to be at the bedside and what that feels like. But I try to insert myself in as many of those decision-making processes as possible. When you work for a large enterprise, it becomes a little bit complicated because sometimes those decisions are made at an enterprise level and maybe you're at an operations. For me, I have one campus that I'm responsible for. Well, there's decisions being made for 18 campuses. And so you win some and you lose some. We always say sometimes there's winners and sometimes there's, I wouldn't say losers, but you might not get exactly what you want, but we have to make the best decision that we can for the population we serve and the hospitals that are a part of our enterprise. So sometimes what might be best for me in Washington Township isn't maybe best for Center City and Philadelphia. And so we have to make those decisions based on priority and based on risk, essentially. So, but I think it's really important to make sure that you're staying involved and understanding what's happening, because if you don't get yourself involved, you won't have awareness. And so for me as a leader, it's really important for me to be aware and involved and engaged and partnering with all of those other departments so that I can help make the best decision for my employees and my patients, as well as building the relationships within my own campus and making sure that my staff feel that they are able to come to me with questions and concerns and needs and wants as well, so that I'm always aware and knowledgeable of those things, that when I'm sitting at the table making those decisions, I'm able to make the best decision. I think you asked me what the most challenging thing is with that. I think the most challenging thing is you want everything, right? You want to buy everything, all the greatest and the latest state-of-the-art technology, and we only have so much money, so we can't always do that. But I think sometimes prioritizing what we need is a challenge, and wanting to stay, cutting edge and being able to provide care that is competitive and excellent and all of those things is something that, weighs heavy on you when you're at the table trying to make those decisions, and understanding, is this the right decision to make right now, or maybe it's a decision for us to make, in 5, 10 years, depending on what our strategy is.
That's a great segue to the next question, is just thinking about the future 5, 10 years from now. Is there anything in particular that you think is a total game changer for healthcare when it comes to technology?
Yeah, I think right now we're in a very interesting time, and certainly COVID has catapulted us in this area of technology. And I think the game changers for healthcare right now are really those non-healthcare organizations, right? So I'm talking about the Googles and the Apples and the Amazons of the world that are really going to come neck and neck with us in healthcare from a competitive standpoint. And we know how quick and how savvy these these corporations are, and things that they can bring, quickly to people's fingertips. And so I think that's going to be a real game changer for us in good ways and in, challenging ways to kind of challenge healthcare to step it up a notch. And what can we do? I mean, if you look at Apple, they kind of started with apps, and I think probably most people have been exposed to some of the apps or the iWatch and different things for that they've implemented with, research around the heart studies and different things like that. But, they've done a lot through COVID as well. And they've actually contracted with Google for some of the Bluetooth enabled contact tracings for COVID. So there's a lot of different things happening in that sector. Google has recently hired, a handful of healthcare executives. So when you wonder about, what can I do in healthcare if I get a degree in healthcare, or, there's the world right now is really endless with that. But Google has hired, previous Cleveland Clinic CEOs, a previous Geisinger CEO. They've hired Department of Health and Human Services official recently. So they're hiring a lot of the very smart individuals and leaders in healthcare to assist them with some of the platforms that they're working on. And then of course we have Amazon, who is working really with different avenues, supply chain, pharmacy, insurance companies, care delivery. I mean, the list goes on. And they're using their massive employee base as kind of their subjects and their ability to test some of this technology that they're using. So, I mean, they're using their employees to test out all of the things that really telehealth can do. I mean, telehealth was something, as we know, that has been around for a while, but not really used to its full potential. And COVID really pushed that for us. So we have certainly gone rapid speed ahead, but we really need to keep up with all of that. So I think for me, those are the things that I think about to wonder, and to think like, what will be a game changer? I think it's all of those things outside of healthcare that's going to force healthcare to think differently.
How do you stay on top of those things you just mentioned? How do you find out about that stuff? Are there conventions that some of you get sent to see what kind of the latest trends are?
You can't, I mean, certainly a lot of this is self-driven and really just staying up to date with, research that's out there, journals, modern healthcare, things like that, but also getting involved in your local chapters of, healthcare organizations. For example, I'm a member of the American College of Healthcare Executives, as well as the American Organization of Nurse Leaders. And if you get involved with your local chapters, you learn a lot as you network, you learn a lot, you pay attention to the news, you hear a lot of things. You surround yourself with people in healthcare, you learn a lot of things. So there's a lot of different ways to keep yourself informed, but there's so much going on all the time that it can be overwhelming, but it's exciting. And you just wonder what the future of healthcare might look like. It's quite a transitional time.
My last question is specifically about nurses working in informatics. Where do you see growth and the most potential for those jobs for nurses who want to work in informatics in some way?
Oh, geez. Well, I will say that our nursing informatics team here for me is like a lifeline, because often I'm reaching out to them. And part of that is because, as we all know, we are so data driven in healthcare that if our data doesn't work for us, or we can't get access to data, or we don't have ways to collect data, that becomes really a handicap for us. So I think that, if there's a nurse that's interested in informatics, really the sky's the limit at this point. I mean, when I think of all of the things that can be done in informatics or is happening, there's certainly lots of jobs and lots of experienced help needed within the healthcare system, whether that be an acute hospital or, population health. There's certainly needs for that. There's also, needs in places like Epic, and all of these institutes that actually sell and produce these information technology platforms. They need nurses and help with that. And then, you look at the things that I just talked about, the Apples, the Googles, the Amazons, they're all going to need healthcare professionals, nurses, to help support their growth. And then, the other thing that we have seen in healthcare recently, and it started really happening a little bit during COVID even more, is really cybersecurity. And so there's a whole world outside of even just taking care of patients, but how do you keep a healthcare network safe from a cybersecurity situation? Because, you know, to our experience, we haven't, thankfully, knock on wood, had any of those challenges, but I certainly have had colleagues throughout the country that have gone through that. And, you know, when you lose your ability to have all of this technology that essentially keeps our hospitals running, it's a real crisis. And so there's a whole world out there with cybersecurity and safety that also is, you know, certainly available to those individuals who are interested in informatics and in a healthcare industry.
Dr. Shingler-Nace, the transformation over at Jefferson's Washington Township Hospital is impressive. Thanks so much for taking your time out of your busy day to share your expertise with me and the Felician students.
No problem.